So hello and welcome back to another edition of Headlines with Harris. And we're joined on the phone by, a regular guest here, and that is Admiral Joe Sestak. Admiral, thank you so much for joining us.
Jeff, good to be back.
And I know last week you really focused on immigration reform for economic growth. And, the one thing in your press releases that really stuck out to me was about a woman that you helped to obtain a green card so she could go to school. And now I understand that she is a naturalized citizen. I was wondering if you could kind of walk us through what happened there.
Absolutely. She immigrated here. She did have a visa, but then it was expiring and needed to work through the system. But she had been accepted to the University of Chicago, and she couldn't even, and her opportunity to go there with financial aid was going to evaporate in a day or two. And so somebody recommended they come to my congressional office. As you probably know, Jeff, we kept it open 7 days a week, so people would come at, even in the evenings, to 8 or 9 at night. We rotated interns underneath our staff so that people could always come in. And told us about it, reached into the bureaucracy where things were stifled, and she got it, got financial aid, went to the University of Chicago, and now she's applying for medical school to be a U.S. Army doctor. Is that the American dream?
It sounds like it. And, I know that, throughout the entire week last week, you did focus on immigration reform for economic growth. And, this woman at the University of Chicago, she's only one example of that.
Only one.
What other events, rather, did you go to or attend or hold to focus on these points?
Well, I was up in Reading and then went to Norristown, and at both places sat around and talked about two primary aspects of immigration. The first was like my father, who came over here to be all he could be from Czechoslovakia, raised 8 kids, used to sit at the kitchen table and say, penny for food, penny for college. He served in World War II. He served 20-some years in the Navy. I wanted to be all like him, and he had 8 kids. All of them went on. All of them got masters or beyond and are productive citizens. That's the American dream, and I talked about that aspect of it. But second, I talked that within that group, what we also need is to focus increasingly upon those with science, technology, engineering, and math backgrounds, that we're able to get them to fill the over 6 million jobs that we're going to need that have to have STEM, science, technology, engineering, math backgrounds by 2022. And second, the undocumented. People can say what they want, but the reality is, pragmatically, we have to come together as a nation and make sure that, yes, we secure our borders by high technology, like using drones. But second, what we have to do is have them come out, back of the line, actually pay back taxes, be fingerprinted to see if there's any types of crimes in the background, and they get to the back of the line. But eventually, they are in line for U.S. citizenship. And every study shows that in the next 10 years, if we were to do that, $1.1 trillion is added to our productivity. No job loss. In fact, $600 billion are paid into from their revenues, Social Security, to keep it solvent. And an equivalent amount goes into Medicare. This is something that benefits us all.
And I know that, as the weeks go on, a big thing for, the Sestak campaign is walking in the shoes of the American people. And as the weeks go on, I know that you are focusing on separate topics. This week is healthcare. This past week, as you mentioned, as we were talking about, is immigration and reform. Are you going to circle back to some of these topics, as I guess, this new year, as the weeks and as the months progress, going to different areas of Pennsylvania and not only talking about, the healthcare issue, but now circling back to the immigration and reform problems?
Absolutely. As we do healthcare this week, we also had done healthcare, different aspects of it, ever since I did the walk across Pennsylvania, those 422 miles, each day doing an event. And one of the days was on healthcare. Another time I was over in Harrisburg, I focused upon rare diseases and the research needed in them, such as sickle cell disease. And then I also talked about mental health at another place. Immigration, you'll see I did it before, I did it again in Reading and Norristown. We constantly circle back because there is, within my book, because I turn down lobbying jobs. I did not want to be a lobbyist like 400 senators and congressmen did after they left the Senate and Congress. I instead went back to teach with our National Treasure Youth, and we researched topics together. And then I did 800 events for other people and learned about it. And so there are many threads needed, brought together in the book that I produced, that say how we have to restore the dream. There's no one answer, but there's a lot of different threads, and that's why I keep going back to each of those threads and highlighting them so people know this is where I stand and this is what I will fight for you.
And Admiral Sestak, you referenced that 422 miles, that walk across Pennsylvania. And for those that don't know, if you go on to, the campaign website, joesestak.com, you can track that entire walk, that 422-mile stretch. But another thing that we touched on was healthcare. And again, on that website, joesestak.com, there's a health security strategy under one of the tabs. And Admiral Sestak, one of the first things on there is that you voted for the Patient Protection and Affordable Care Act, the ACA. And that was in order to increase Pennsylvania's access to quality care, reform the broken health insurance industry, and save lives.
You're absolutely right, Jeff. My daughter, I'd come back from the war. I'd been gone at sea for about 12 months, came back, and shortly thereafter, my daughter, my only child, who's now 14, was struck with malignant brain cancer at 4 years old. I got out of the Navy, and after 3 brain operations, chemotherapy, radiation, I needed to pay back my country, who gave me wonderful military health care the taxpayers had. And I came back here to my home where I was born, Delaware County, and fought hard for the Affordable Care Act. This was 2006, and it was my primary item on my website. I will fight for health care for everyone that's affordable. And in fact, when I fought, and I love those town halls with the Tea Party, and I explained to them, look, now your child can stay on health care until they're 26 years old. And seniors, Medicare was becoming insolvent. Next year, 2017, we extended it to 2030. And then we ensured that women no longer pay twice as much for a man. And every child gets free immunizations. They get it all free. And your visits to the doctors for the certain types of mental health screening and other types of aspects as you're growing up are free. We worked hard. And not only that, but the Congressional Research Service said that last March that because it's working so well, it will save another $100 billion than what we thought it was going to do for our government. And so therefore it was affordable, accessible, and quality health care we work towards. And I would fight for it every day again for Americans living here in Pennsylvania.
And how exactly can you build on the success of the ACA? Now that you see the results, and you see, you're extending this through 2030, and it's already become successful, how can you build on that success and even go further?
Well, let's take that Medicare plan. Right now, Medicare cannot bargain by law with pharmaceutical industries for the best price. The Veterans Administration can. So if I, as a vet, go to the VA for a drug, they can negotiate best price. I will pay, if I went for the same drug to Medicare, 2, 3, or 4 times more because Medicare has to take what's offered to them. By law passed in 2003, if we remove that law and they negotiate for best price, we would save seniors and everyone else on drug costs $123 billion in the next 8 years. Also, when a drug company has a patent on a new drug and it's about to expire after, let's say, 10 years, guess what? They then say to some, like Tylenol all of a sudden is about to expire as it once did. Well, a generic type of Tylenol will spring up that will cost half as much. But what the one who owns the patent, they give millions of dollars to that generic company and said, if you do not produce that generic, letting us still sell the very expensive brand name Tylenol, whatever drug it is, we'll make money, you'll make money. And that's called pay for delay. If we remove that, we would save $3.5 billion every year because that is what inflates the prices of our drugs. Those are the common sense, fair to people here in Pennsylvania that I tried to get through when I was down there, and we're going to get through as a United States Senate, because it's good for people to pay less and pay a fair price for the drugs, not to be paying more than they should.
And Admiral Sestak, I know we're cutting short on time a little bit. We actually went over the allotted time, but we're going to end the interview as we usually do. And, we know about immigration and reform. We know about healthcare, the things that are going on, your event in Johnstown the first week of January, talking about the plan for restoring the American dream for working families. And you talked at Integrated Technology Services International about that. What can we expect, now moving forward? We're now, towards the end, the middle of January, moving forward into the winter months from the Sestak campaign.
You're going to see us stress heavily education from pre-K, because we want every child to have an opportunity that's affordable, to making sure that moms and fathers who work have earned tax credits that would let them for health and child care, but also affordable college. And my book proposes and shows how both you can temper down the cost of colleges and also cut the interest rates for student loans by almost half. And so those are and because the government's making $129 billion right now off the loans they're giving students. What? And so that's one area. Another area is manufacturing and jobs, because jobs are about to come home. And that's why I was vice chairman of the Small Business Committee, because small businesses are 98% of all manufacturing firms. Remove some regulation on them, give them access to capital to start up, and we get job demand going in manufacturing.
Well, as always, Admiral Sestak, we appreciate you taking the time out to call into WCHE and discuss some of the things that are going on now that the new year has come and it's 2016. And of course, as we all know, 2016 brings the election. So we always want to thank you for taking the time out.
Thanks, Jeff. You have a great day.